guys, welcome back to my channel. This is Achi and today we have another physical therapy video for you guys. So before we start, I would like to thank the sponsor of this video, Kape ni Dos. So if you guys want some quarantine caffeine, you can check them out on Facebook, Twitter, and Instagram. So let's begin. So guys, last week I asked you on my Instagram, Facebook, and Twitter if you guys have any questions about physical therapy or physical therapists here in the Philippines. So, nakakuha ko ng mga responses and thank you for those people who sent their messages and sent their questions. And aside from those responses, I also gathered some questions ng mga naririnig ko or mga natatanong sa akin before. So, start! First question, what is a physical therapy or physical therapist? So a physical therapist is an allied health professional who is called the expert in movement. So what we do is that we help people to move from point A to point B without causing them any difficulties or without causing them any pain. So we provide evaluation, proper evaluation kasi the more that we know what's the problem of patient, and then the more that we can provide the proper treatment for the patient. So we do proper assessment, and then we do the diagnosing. We tell the patient, oh, this is what you have, this is what you need to improve, and then we lay them out the program, the plan that we have for them. So this is what we're going to do. Meron tayong ganito, may ganito tayo. And then these are the short-term goals that we have. So in this span of, let's say, a few weeks, you should be able to do this. And then in a span of a few months or a year, depende, so anong case man, you should be able to do this. So we have this plan to help kung ano meron yung problem na meron ka dun sa assessment natin, sa evaluation natin. So that is what we do. We evaluate, we diagnose, we give the plan of care, we treat, and we help our patients to improve themselves, to be a better version of themselves, to get up back on their feet and move forward. Okay? So, yun ang isang physical therapy. So, question number 2. How long does it take to be a PT in the Philippines? So, here in the Philippines, sa old curriculum, it will take 5 years to be a physical therapist. I know, 5 years in the school. Yun yung lectures and lessons mo sa school, and then you have your internship. And then after you graduate, you have your bachelor degree, but you are still not a licensed PT here in the Philippines, and you will not be able to work as a physical therapist. So what you need to do is you still have to take your board exam that is given twice a year. That is February and August. So you have to take that board exam, and then after you pass the board exam, then you will be a physical therapist here in the Philippines, and you will earn the title PTRP. So question number 3, what are the different areas of PT? So maraming area ang pwede mo puntahan as a physical therapist. Like me, I love working in the pedia sa mga kids. You can go to neuro, you can go to ortho, yung mga nagkakaroon ng fracture, nagkakaroon ng problem with their sa development ng bones. You can go to obstetrics, you can go to women's health, you can go to rheumatology, you can be a home health, physical therapist, the home care, you can go to that. You can go to cardiopulmo, it's another fun area, cardiopulmo, you can go to that also. So there are different areas of physical therapist, and you can go pa nga sa research if you want. You can go to teach also. Physical therapists also teach other future physical therapists at school. So sa PT, you have variety of choices na pwede mong puntahan. You just have to find yung right one para sa you, the one that gives you the fire to go do your work. Okay, fourth question. What are the different management that a physical therapy can provide? So we as physical therapists give a patient a different varieties of management. But it depends sa kung ano yung problem ang meron sa pasyente. Like, so just to give you guys an overview, meron kaming electrotherapy. We can give electrotherapy. We can give hydrotherapy. If you guys know, water is a very, very powerful tool. We can give exercises. We have the therapeutic exercises. We can give pain management. We can give, of course, patient education, and that is also very important, diba? So, fifth question, is PT a masahista? Okay, so ito is sobra. It's a very common question na maririnig mo, lalo na sa mga kababayan natin na hindi pa talaga o hindi ganun ka-aware kung anong isang physical therapy. So, is PT nga ba isang masahista? No. And we are different from our masseuse therapy. So, what is the difference between a PT and the masseuse therapy, diba? So, like I said, we physical therapists, we evaluate, we diagnose, we give the plan, we treat the patient. The masseuse therapist natin, what they can give to you is relaxation of our bodies, of course. Diba usually nagpapamassage tayo or nagpapapunta tayo sa massage therapist kapag papagod ako or ganyan. Okay, of course, they can give you the relaxation, they can give you temporary relief sa pain na nararamdaman mo. But of course, if your pain naman kasi is like matagal na, you should seek proper healthcare advice na. To avoid na rin kung ano yung, diba? To avoid na rin para malaman mo na rin kung ano yung, kung meron bang problem sa body mo or diba kung ano yung kailangan mong gawin. So, I think that's one of the main difference is because massage therapists, they use massage for helping their clients. We, as physical therapists, use a variety of interventions like, nabanggit ko kanina, electrotherapy, hydrotherapy, therapeutic exercise. That's the big difference kasi. Next question. How do you address a PT? So, ano ba talaga yung tawag sa amin? Usually din tinatawag kami ng doctor. Are we really a doctor? So, here is it. We are now... It depends, actually. Well, it varies from one hospital to another. Minsan may mga PT na tinatawag sa kanilang doctor and they say yes. But, of course, for me, with respect sa ating mga doctor who took their doctorate degrees, diba? We are not called doctors. We are rather called mom and sir. Depende, of course. But we are like doctors na din because we evaluate. We are like, but we are not yet called here sa Philippines. But of course, ibang bansa, they are called as doctors na kasi after they graduate, alam ko diretso na silang doctor physical therapy. While here in the Philippines before, ngayon, after mo mga ka-graduate, you are physical therapist. But you are not a doctor pa. You still have to take your doctorate for physical therapy. And that's the difference. So, you would usually call us na ma'am and sir. Magandang course po ba ito sa college? Yeah, 7th question. Magandang course po ba ito sa college? I would say definitely go for it. Go be a physical therapist. Go take physical therapy in college. Especially if you want to go to med school. Kasi una, we are not called movement experts for nothing. We memorize as in, we memorize the anatomy in school. I cannot say the same pag nakagraduate ka na. But, yes, we study the anatomy sa school, especially yung ating skeletal and muscular system, and cardiac system, and pulmonary system, all of those. We have anatomy, we have physiology, we have kinesiology sa ating course curriculum sa school. And yung books na ginagamit namin is the same books na ginagamit ng ating mga medical students. So I think if you want to go to med school, you should take physical therapy at your pre-med. It's a really good course and also it will give you an advantage. Next question. This is a patient, usually this question is usually tinatanong namin yung mga pasyente. Ma'am, sir, do I really have to do all the exercises at home kahit nagawa ko na sa aking PT session. Yes po. Kailangan niyo pong gawin. It's for you. Kasi, like, example, you see a physical therapist, let's say 3 times a week lang, and we have our session 1 hour lang for that week. So, for that week, we have 3 hours lang kasi 3 times a week, diba? Only 3 hours of exercise yung ginawa mo. Pag sa bahay, nahayahay ka na. Hindi mag-work yung muscle mo ng ganon. Kailangan talaga repetition. Sabi nga nila, diba? No pain, no gain. So, you have to work it out sa bahay nyo pa rin. And that's what we always remind the patient. Ma'am, sir, pakigawa yung exercises sa bahay. Tinuturo po namin dito para gawin nyo po sa bahay para mag-improve po kayo lalo. Ganun yung yun yung sinasabi natin para ma-help natin mga patients. Okay? So, with that questions, yes po, you have to do your exercises at home. Kahit na ginawa mo pa siya dito sa it's a yes. The next question is, what is the role of a PT in treatment of COVID-19? Okay, this one is this one is a serious question. So, I hope you guys are still listening up to this part of the video. Okay, what is our role in treatment of COVID-19? So, as you know, we are in the middle of a pandemic. And our healthcare workers, our doctors and nurses are fighting the war against the COVID-19. And we as a physical therapist, ano nga ba yung nagagawa namin? So, here's what we do. Patients who recovered from COVID-19 and those who are still kahit di pa nakaka-recover, like for nyari, patients who are in the ICU na, of course, nakahiga lang, naka-bedbound lang. Alangan, diba, imagine if you just lay like that for a whole week because, meron kang virus in your body, you cannot do anything. What will happen to your muscle? Of course, they will go weak to the point na hirap ka kahit minsan huminga, like that, example, huminga. Of COVID-19, diba, it's one of the problem is, sa mga symptoms ng mga ating COVID-19 patients is they have difficulty in breathing. We as physical therapists can help you with that in proper inhalation, expiration, of course. Iba pa yung ating mga respiratory therapists and I salute to them. We as physical therapists also, we can provide proper positioning to help remove yung mucus, yung phlegm na meron ka sa lungs mo, to help you na mailabas yun sa lungs mo and you can breathe properly. We can help you after, while you're in the ICU, while you're maraming nakakabit sa'yo, we can help you by exercising you kahit nakahiga ka. Yes, we exercise you. Gagalawin namin yung arms mo, yung legs mo, just so hindi magkaroon ng muscle wasting. That's what we call muscle wasting. Hindi magkaroon ng atrophy. Kailangan namin galawin para hindi magkaroon ng contracture. Para kapag gumaling ka na, kapag paalis ka na ng ICU, pwede tayong mag-start na gagawin mo na ikaw nang gagawa. Tutulungan ka namin step by step para ma-reach natin yung goal, para magkaroon ka uli ng lakas. From nakahiga, tutulungan ka namin na makaupo. Makaupo ng mga 75 minutes hanggang sa kaya mo na makaupo ng matagal. And then after that, pinaka-favorite part ko sa bilang isang physical therapist is helping our patient at least kahit man lang makastand and take their first step. That is so important para sa kanila. It's like watching your baby take a first step. Bilang isang parent, kung meron man sa inyo nakikinig as parent, and you see your babies, you see yung mga anak ninyo na taking their first step, that's what we feel as physical therapists, to see our patient na makakuha ng first step, makatayo man lang mag-isa. Yung joy nila, that's what we live for. For me, that's what I live for as a physical therapist. Yung helping them to recover from, like, oh, last week nakahiga ka lang, ito lang nagagawa ko, and now nakakaupo ako, now nakakatayo ako mag-isa without any help because you help me. And kahit nagkaroon ako ng, like, this our COVID-19 patients, kahit nagkaroon ako ng COVID-19, it's dangerous, but you did not hesitate to help me because you want me to be better, you want me to go back to my old self. That's the best thing about it. And that's what we can do as physical therapists and helping our COVID-19 patients from those na syempre nanghina na sila, nakahiga na sila, karoon sila ng muscle weakness. We help them exercise, we help them magpalakas, we help them to take their first step towards a new life, towards their new life, 'di ba? That's the best thing about it. Okay, next question. What changes happened in the physical therapy rehabilitation due to the pandemic and how do we deal with it? Paano nga ba? Okay, so as physical therapists, what noon pa lang, even before the pandemic, we are so close contact with our patients because syempre we help them. We transferred them from like wheelchair to bed. We help them stand up. We help them walk. Of course, ano yun, hindi kami pwedeng malayo. And dahil sa pandemic, alangan naman daw speak namin. Paano yun, diba? Paano namin sila na-exercise. So, we still have close contact with them. So, what changed? Of course, meron na tayo ngayon face mask. We have the PPEs. We have our masks. Face shield. We have, of course, pinaka-importante is the patient education. That is very important also in helping fight this COVID-19. Another thing that's changed is that before, we have our home health physical therapist or what we call home care na pupunta from a house to another house. One of napansin ko since COVID-19 is that some of our patients, syempre, some of the clinics closed during the quarantine, diba? So, syempre, some of the patients were not able to go to their physical therapy. So, iba opted to do their home health or home care physical therapy. What changed is that we have our group therapy session. Hindi na namin siya magagawa, of course, syempre, hindi na namin siya magagawa kasi we are trying to limit the number of people dito sa clinic. And dahil kung dati, it's by, pwede kayong what's called this? Walk-in. Now, kailangan na syempre ng tawag dito, appointment sa clinics. And syempre, mas mahirap siya sa dami ng patients na i-treat mo. Kailangan stick ka sa time mo and limited yung number ng patient na nasa loob ng clinic para maiwasan natin yung pag-spread ng virus. Diba? So, that's one of the changes na meron since nagkaroon ng pandemic. Alright, so bonus questions. So, those were 10 questions and we have bonus questions. So, some of you sent me some bonus questions. Next one is, what is the strongest muscle in the body? Oh gosh, no. Okay, to be honest, but I think strongest. It's not a muscle lang. I don't think it's isa lang. I don't think isa lang siya. Alam ko marami silang muscle na strong. Wala tatang strongest na isa lang talaga. But I would say one of masseter. Masseter is your for showing a moving down. So, of course, syempre, diba, that's one of, strongest thing kasi lagi natin nagagamit. Like, for speaking, we are moving our jaw. And for eating, we are moving our jaw. So, sabi nila, isa yan sa pinaka malakas na muscle because it can break ilang tons yun. Basta, it can break, you guys can search about it. It can break 1,000 tons of weight while chewing. It can break it, that muscle. Alright, last question for this video. Last question. Do you have a favorite bone? No, because I love all the bones in my body. Even if they're, I love all the bones. I don't have a favorite talaga na because of dysfunction or dysfunction. Wala. I love them all kasi very important lahat ng bones mo, diba? Syempre, alam pag may nawala ng isa, di parang may kulang sa iyo. So, I love all the bones in body. But, if you can ask me about, I have a favorite lang to pronounce. Not really a favorite, just that's the name of the bone. Nothing serious about it, just the name. I love the name, the bones, fibula and tibia. If you guys, it's the shin here, like that. Sa, fibula and tibia. I think it's a very cute name. And I think I'd like to name my dog that. Maybe like, yeah. It's like cute name na muscle. So I think that's one of my favorite muscle to pronounce. But I don't have a favorite in terms of what they do or how big they are, ano mang sensitive. Ayun. So that ends our video for today. I talked about a lot of things about physical therapy for you guys, and I hope na may natutunan kayo or may naintindihan kayo about it. And don't forget to leave a comment, like and subscribe, and click on that ring button below so you know when I have new videos about physical therapy or about travel or about anything like this one. So that's it, and thank you guys for watching. See you next time.